All right, Dr. Rice, thank you for joining us and agreeing to do this interview.
No problem.
Yeah, so tell us a little bit about yourself, like your hometown, undergrad, that kind of stuff.
Well, first of all, my name is Ashley, and I'm a third year general surgery resident at Sinai Grace in Detroit. I'm originally from Indiana, Pennsylvania. It's a really small town, like an hour outside of Pittsburgh. I went to undergrad in that town, and then I went to medical school at VCOM in Spartanburg, South Carolina. And then after that, I obviously matched into general surgery at Sinai Grace.
Cool. Well, that's a good segue. What made you choose general surgery? What made you pick that?
I know that I always wanted to do something more hands-on, something with procedures. And in med school, my med school didn't really require us to do a lot of, I guess, specialized fields in surgery, but we had our basic general surgery rotation in my third year. It was definitely the most time-consuming, the most challenging, and the most exhausting rotation I did third year. I actually did it my third year at a program that had residents, so we kind of followed the resident schedule. Um, but I enjoyed it so much. It was exciting to go to work. It was fun. I really enjoyed what I was doing. And then I went to different medicine rotations, and although some of them I did have a little bit more free time, I went and I found myself just really missing the hands-on aspect of surgery. I just love that your patients can come in with a problem and you can go in, fix the problem, and then even as soon as like in PACU or right after the surgery, they're like, wow, thanks, I feel so much better now. So it's just something that was really cool to me. You can just use your hands and fix a problem. So
Yeah, I love that too. I think that's probably one of the reasons that I'm interested in pursuing surgery is because you have a problem, you can do concrete things to fix that problem. You have an end outcome that you're looking for, and hopefully it's a good outcome. So
right.
yeah, that's awesome. And what made you choose that residency program, the one at Sinai Grace? And then what did you have like criteria when you were interviewing, like when you were going around looking at programs, were you like, oh man, if they do this, I'm not going to do it, or if they have this, I love that, like that kind of stuff?
Well, obviously I have no understanding of the match process. I don't think anybody does. But I knew that I wanted to do general surgery, so that was really my driving force of everything. I interviewed as many places as I could. I ranked all the places I was willing to go. But the one major thing I was looking for when interviewing, which maybe not everyone looks for, but I was looking for a fit with the residents that you work with, and if I could get along with the residents that I work with. With general surgery, you spend a lot of time at work, obviously, and the people that you work with can really make or break your day. And I found that if I got along with the residents that I either auditioned with or interviewed with, I was more drawn to the program. Of course, you want to look for case volume. You want to look for whether a place has high volume trauma is what you like, or high volume general surgery if that's what you like. Um, but I also find that you can cater programs to find the surgeries that you want, but you can't change the people that you work with.
Yeah.
So that was really important for me. Another thing that I found that not necessarily what I was looking for, but what I wasn't looking for was a program that required you to travel around a lot. There are some programs I interviewed at, and it's important to ask how many hospitals they cover. There were some programs that would cover up to 5 hospitals, so depending on where you lived, you could commute an hour no matter where you worked. So the program that I'm at, we are mostly at 2 different hospitals, although we do have rotations at other hospitals in the Detroit area, as well as hospitals in some rotations in a different state. But that's not the majority of our time. The majority of our time we're spent at 2 hospitals that are easy to commute to. So that was important for me too.
Yeah, no, seriously, that's interesting insight. We've heard different things from different people, but one of the consistent things is making sure that you're with people that because surgery is all the surgical specialties have long residencies. So you're going to be with these people for a long time, and you're going to be at the hospital a lot. So when it's 2 a.m.
Right.
and you're
Maybe.
tired. Yeah, no, for sure. Absolutely. Yeah.
Right.
Great. So this is a weird question, not a weird question, but a hard question to answer because a typical day is not really a typical day. But if you have a typical day or a couple typical days, what does that look like for you? Especially now that you're a new senior resident. Congratulations,
Yeah,
by the way.
thank you. So I guess I'll just go over like a typical general surgery day because we obviously have different rotations. You know, we rotate in trauma and vascular surgery and all the specialties. But for general surgery, our day will start rounds anywhere from 5:30 to 7. So it depends on what we have going on in the morning. If we have didactics in the morning, cases in the morning, or whenever we have to get our day started, that'll determine when we do rounds. The juniors will come in and get or prepare the list or look through the patients, you know, get numbers, vitals, all of that. So they're typically there earlier than the seniors. Then the seniors come in and we go on group rounds together. Our program specifically doesn't do the where the juniors pre-round and then we round again and then we round again. We just all round as a group in the morning. After that, then it depends on the day. Like I said, we might go and do cases. We might have didactics in the morning. We might have grand rounds and M&M. So that is the thing that really varies per day. Um, and then depending on what cases we're doing, it'll depend on, I guess, really who goes into the cases. If it's more of a junior level case, senior level case, so that'll determine, I guess, who's in there. And then throughout the day, we try to you get the floor work done, you know, so that's kind of an all day event where you're getting the notes done, you're getting your orders in, you're following up on things all day. Meanwhile, consults are coming in and out. So I mean, some days are busier than others, but our days typically go from like 5 or 6 in the morning until sign outs at 5 at night, but you never really expect to leave by 5.
Yeah.
You know, you leave when work's done.
Yeah, no, it makes sense. Cool. This is kind of this is a few years away for you, but do you have any idea what type of practice setting you'd like to be in? You mentioned like if you like trauma, looking for a trauma program, or you know what I mean. Do you have any idea of that type of stuff, or academic, private, that type of stuff?
I think from where I am right now, I am looking at a more rural to suburban setting and not necessarily academic at this point, but I think more of a community hospital base for me. I'm not, I don't see myself at this point wanting to go into trauma surgery or any sort of big specialty. I am still considering fellowship, but I'm not really sure at this point. But I personally like living in smaller areas versus living in a more urban or inner city type area, I guess.
Yeah.
Although it can be fun and exciting, and there's a lot of things that happen at Sinai Grace, but it's
Yeah.
just not speed of lifestyle. So
Yeah. Yeah, I'm from a rural area, and I intend to practice in a rural area, or maybe maybe not rural, but probably not an urban city. But at the same time, when I've been at Sinai Grace, it's been a very interesting experience, to say the least. There's a lot that goes on there. So
right, it can be fun, but I know just for me, where I want to live is more rural. So
yeah, yeah. Do you have any advice for people that are considering general surgery, like in how to like either excel to match in a general surgery, or to decide that they want to do general surgery as opposed to whatever else that they might be considering?
I think looking back, I think that it would have been nice to have or to rotate during my medical school years in different surgical subspecialties too. Like I said, I only did general surgery, and then whenever you go into general surgery, you kind of experience other fields of surgery as well. You know, like urology and ENT and things that I didn't necessarily think about whenever I was applying. I don't know if that would have necessarily changed the path that I went into now, but I think it's a good idea to expose yourself to these things earlier on. I also think it's important to realize, I guess it's with every residency, but specifically with surgical residencies, they're longer. So it is a sacrifice. I mean, you're giving up 5+ years to your residency, and you don't have as much time for your family and your friends, and you have to be willing to accept that and um, that's going to be part of your life for the next 5 years. You know, you then start fitting your family in when you can, instead of, you know, actually your family doesn't expect you to be at holidays anymore or stuff like that. So it's something you have to take into consideration and realize that you will be making sacrifices for a little bit longer than some of the other specialties. I think, like I said, no matter what, you go into residency, you're working long hours, your vacation's limited, and everything like that. But surgery specifically can be a little bit longer. And 5 years is kind of a long time.
Yeah.
So, my recommendations for, I guess, planning and trying to get into surgical residency, I think you have to think about what type of program you want to get into. If you want to go into a more academic program, then obviously find ways to get involved with research, find ways to really boost your CV and look good on paper, because unfortunately a lot of people apply and all they do is look at what you send in. So they look at you on paper and they don't know you as a person until they interview you, but you're sorted by paper first. So I think some of the more community-based programs aren't as strict about research, but I also know that the whole match process is kind of changing, especially now after the merge happened, that it is more competitive. I mean, you're competing against a lot of people now. So I boost your resume or CV as much as you possibly can. And board scores are really important, although I have seen with some people that they're not everything. And getting audition rotations can really help you, but also realize that they can hurt you too. When you go, it's not just showing up. You have to show and prove yourself at audition rotations. Because if you go and you don't really make a great impression, then they're not going to interview you based on that. When they may have interviewed you based on your paper. So just keep that in mind whenever you're doing auditions. They are helpful and they can be helpful and important, but work hard.
Yeah, no, that's great advice. I mean, you know, and that's an interesting thing I've talked about with some people, you know, surgeons and then other medical students during this time, where it's hard to hone your skills. You know, if they're trying to decide if you can do a subcuticular, you know, suture, and you've never done one because you've been in quarantine for 6 months, you know, it's a bad time to try to be auditioning. Anyway.
Right. No, it is. Practice your ties while quarantined.
So do you have any sort of like favorite case or favorite patient, or even just like, man, I really love doing a cholecystectomy. It's like my favorite thing to come in and do a cholecystectomy, or whatever, you know, whatever it may be, or even just a patient, respecting HIPAA, obviously, but do you have something like that that just really you love?
I can't think of a specific case right now. I think that they're all cool in their own ways, but I think the patients I remember the most are the ones that you more emotionally bond with, I guess. So they are grateful for the help that you gave them, and they remember who you are, and they see you coming in and checking them on them every day. And then you'll see them in clinic a few weeks later and they still remember you, and they smile when they see you and say, like, thank you for all the help you did while I was in the hospital. And that honestly means more to me than really anything, because then you actually feel that you made the difference. You know, with residency, sometimes you forget that you are making a difference because you feel really tired, you feel really worn down, and you feel like you're never really doing anything good enough. But whenever your patients can come to you and thank you and like smile when they see you, and you can tell that you really made a positive impact on their life, I think that makes any day worth it. You know, it makes
Yeah.
residency worth it, and it's a reminder of really why you went into medicine to begin with. And it's easy to forget that. But when you make a difference like that, then it kind of brings a little bit of light back into your life and makes it worthwhile.
Yeah, seriously. That's awesome. Yeah, I can imagine that would be a boost at the end of a long, grueling day of, you know,
Yeah.
like you were described earlier, basically. Okay, great. Well, that is the end of the, like, you know, scripted questions that I have. And at the end, I like to just ask if you have any general comments about, you already kind of touched on these two things. Normally I ask if you have any comments on boards or research or anything, because students ask about that a lot. But, you know, another thing that we talk about sometimes is whether or not, you know, you as a woman feel like, you've had setbacks due to, basically being in a boys club, because surgery is kind of a boys club. Do you have any thoughts on that?
It definitely is a boys club, but we do have a lot of really strong females in my program too, which is awesome. And then also there's a lot more women entering the field, which is great, and they should keep doing that. I think I'm not a mother. I don't have any of that, and I really look up to those women that can do that, because I have no idea how you can do that with residency. I lose enough sleep as it is, but it is something that as a woman I think about, because once again it's 5+ years and you're seeing all of your friends get married, have kids, and you're still going through what feels like school. We already have gone through school for a lot of years, and it continues through residency, so you kind of feel that little bit of a setback. um, but you'll get to your time and it'll be fine, is what I just keep telling myself.
Yeah.
um, but I think as a woman it can be difficult, because a lot of your attendings are going to be males, a lot of your co-residents are going to be males. It is a very male dominated field. um, Typically I do feel that I am respected, but also, a lot of times I am just a lot of the patients will automatically call me nurse, or whenever I walk into the room tell me, hey, can you go get the doctor? And it takes a little bit to explain that, oh, I am in fact your doctor. So I think it's important though to remember that they don't know, and you just kindly remind them, and just stay confident, because it's just the way that it is. And I think it'll change as more and more women enter the field, but it is something that you notice as a woman, I think.
Yeah, yeah, I bet. I mean, yeah, I mean, I know Dr. Seaman, who's the program director there. I consider her kind of a mentor, and I feel like that's really awesome that, she's a program director, and she's
Right.
been there a
Which
long
is great.
time. Yeah,
Yeah.
no, seriously. And kind of rare, I think, or maybe not so much anymore. I'm not sure about that, but I know that at one point at least it was rare for that to be the case. So very
Right.
cool. Um,
Yeah.
and then I actually did have one specific question that a student had asked me about being a mother. And like, I don't know if you know about the process there, or whether there's, time for breastfeeding and that kind of stuff. Do you have any comments on that? Not that you are a mother, but you know others who are. So,
Right. Yeah. Well, yeah, like I said, I'm not, and I don't know the specific guidelines and rules, but I've rotated with different women who are mothers and have been dealing with the challenges faced with that. And I know that there are women who find the time to do the breastfeeding. It's like with cases and surgeries, it is hard, but I do know that people in our program respect you as a woman enough to realize that you need to take that time for yourself. So yeah, timing might be difficult, but I know women that have made it work. I think as if you're a mom, you're a super strong female as it is, so you make it happen. You do what it takes to make it happen to be a great mom. Surgery just adds another element of challenge to that, but it is possible. There are women in well, not specifically my program that I've known, but within the DMC program that have had children, and they've successfully breastfed. They've successfully been able to have, like, be pregnant and have their babies in residency, and continue to breastfeed and raise their children. It is challenging, but it's definitely possible.
awesome. Yeah, that's awesome. Thank you for that insight. And I guess if you don't have any other general comments, then I think that's it.
Yeah, I don't
Okay.
think so. If anyone has questions, they can always reach out to you, and I can try to answer them for them, though.
Okay. Yeah. Perfect. Great. Thank you so much. This was really great. I really appreciate your. I know you just started your third year of residency, so I know you're busy. So I really appreciate you donating some time to help the SOSA students and other students at MSU come too. So thank you so much.
Yeah, thanks for reaching out.